Let's get some reaction to today's report from David Rowland. He is the director of an independent group which analyses healthcare in the UK, the Centre for Health and Public Interest. Thank you very much for coming in. What should we make of this conclusion that nothing has changed, it could happen again with another surgeon?
I think this is one of the important things to remember from this case, is that the overall financial structures which are in place within the private hospital system in particular lead to over-treatment of patients. So the more surgery which is carried out in a private hospital, the more money the private hospital makes. And unless you put in place very strong restrictions and curbs on those financial incentives, you are indeed going to see something like this happening again. And this is a very extreme example, but the financial incentive structure which is built into the private hospital business model does always put patients at risk of harm.
Is it too far to say you are safer in an NHS hospital then, given what you've just said?
I think it's really important for viewers and patients to understand that when you go into a private hospital, you are not able to access the same post-operative care as you would do in an NHS hospital. So, for example, you don't have access to intensive care facilities in a private hospital. If something goes wrong, you get moved to the local NHS hospital. You often have in a private hospital a single junior doctor being responsible for post-operative care who works on average 168 hours a week. So there are some systemic risks which are built into the private hospital business model that we really do think need addressing.
Of the recommendations you've seen, there are 15 of them, is there anything that you can see, if they were put into action, would stop another Paterson?
Well, quite frankly, as somebody who's worked for quite a number of years within health professional regulation, I've seen lots of these types of recommendations before. Recommendations relating to the system being better joined up, more information for patients, greater consent given to patients. All of those things have been put forward before. My concern is that having seen those recommendations and looked at the overall systemic risks which exist within the private hospital business model, that these current recommendations aren't likely to improve things substantially.
And very briefly, given we are talking about the private sector in one of your previous answers, what should the government be doing in terms of monitoring what is effectively a business?
It's really important for the government to be aware of the nature of the risk that exists within the private hospital sector, particularly because of the fact that now currently 1 in 3 NHS hip operations are done in private hospitals.
David Rowland, thank you very much. Thank you.